Now we are going to discuss few points about stroke in the young. Stroke in the young means strokes occurring less than the age of 40 years of age. Normally strokes are diseases of elderly, that is after the age of 60 years it is very common. But nowadays we are seeing more frequently stroke occurring in the young people. Stroke is nothing but paralysis or any deficits in the body which is related to decrease in the blood supply to the brain. So why this happens in young people who are less than 40 years? Nowadays there is an increased incidence of hypertension as well as diabetes, which are the major risk factors for stroke occurring in the young people. The reason for this is twofold. One is lifestyle. Nowadays sedentary jobs have become very frequent, and exercise should be part of the daily routine for most of the young people, but it is not. Even in either in the schools or in the society, exercise must play an important role, and also we should maintain our weight in a particular range so that your BMI is not beyond the normal, so that that helps to reduce the cholesterol in the body, fat in the body and cholesterol in the blood vessels, as a result of which there is a decreased risk for the stroke. In addition to this, one has to periodically check if you are definitely having overweight. One must check for hypothyroidism as well as hypertension as well as diabetes, because these are all silent diseases, and suddenly one may present to the hospitals with either a heart attack or a stroke. So one has to keep in mind. In addition to this, primary prevention of stroke is important. So what is primary prevention? It is not, primary prevention is nothing but we should not get affected by the stroke. So the main thing for this is not to have bad habits like smoking or alcohol. Not only that, we should have a healthy and calculated diet in which we should keep lots of vegetables, especially the green leafy vegetables and fruits, as part of our eating. Either it can be part of our breakfast or the dinner, so that we improve the increase in the intake of the high fiber diet. In addition to this, as I already said, exercise should be part of daily routine. One should do exercise at least 5 days in a week for at least 3 kilometers daily. Or nowadays yoga is also very important. One can do around 40 to 45 minutes of yoga per day for at least 5 days in a week. So these will yoga improves not only the body's flexibility, it also improves it gives lot of calmness to the mind, as a result of which the stress also comes down. So this applies to most of the software professionals who have a lot of stress and work in the odd hours. In addition to this, one has to have a good sleep is very important. A good sleep means at least one should sleep between 5 to 8 hours per day. Less than 5 hours or more than 8 hours is also unhealthy. So once we know all this, one can keep most of the problems away from us, especially the strokes occurring at young age. And after this, one should know about secondary prevention also. Once a young person is affected with stroke below the age of 40 years, it's very important that you should not get another stroke. Because stroke will reduce your neurons, millions of neurons get damaged once a person gets a stroke. And your mental age also increases. After a stroke, your mental age increases by maybe 10 to 20 years also. So that's why it's important that after the stroke, one has to get investigated for hypertension, diabetes, any underlying cardiac problems, how are the blood vessels in the neck as well as in the brain, and accordingly the medication will be prescribed, and one has to continue all these medications regularly. In addition to this, as I already said, all the factors for primary prevention like your weight management, diet management, good sleep, and not having stress in life, all these should be taken care along with the medication advised by the neurologist or the physician. So all this will prevent having another stroke, because 1 in 3 will have another stroke once you have a stroke. So one has to take care all these precautions so that all of us live a healthy life.